effect in 2013 of March 5th, that is 14 years ago. And that is when the Council of Governors was birthed. And as a result of that, one of the essence of the Council of Governors is to advocate for issues of common interest between amongst the 47 counties, ensure continuous sensitization, and ensure that the Council of Governors and the 47 county governments live up to the tenets and the principles for which devolution was created. As a result of that, we embarked on a journey of asking, how do we then interact with the communities that we serve and the people that we are called to serve? And that's why we birthed the Devolution Sensitization Week, which essence is to ensure that we engage with the community to test the extent and to which services have been devolved closer to the people, to realize and establish the extent and to which there is the voices of the masses in the planning of the county development, in the planning of the budgets, and whether they feel the county government services closer to them. Why Garissa County? This is the 4th Devolution Sensitization Week since the advent of the program. The first one was in Kilifi, the last one was in Nairobi, and the last one was in Homa Bay. And the 4th one was to be done in Nassau County for one specific reason. I want the governor to listen to this very carefully and the whole nation. Why we chose Garissa County for purposes of this 4th Devolution Sensitization Week. There's a lot of myth, there's a lot of fallacy, and there's a lot of bad reporting in as far as SAL counties are in regards to development. I want to confirm that the reason as why we came here is to ensure and tell the whole world that devolution is actualized and is working in the SAL counties. Under the theme, Devolution for Health, Empowered Communities, I want to bear witness what we've seen in this county as a result of seeing whether indeed services are being brought closer to the people. I look at the referral hospital, level 5 referral hospital of this county is nothing short of an epitome of what devolution is. We have gone, I have witnessed, I have checked, and today was the second day that I've gone actually to the level 5 referral hospital in Garissa County. I can confirm to the world that it's a high-class facility with no smell whatsoever, with state-of-the-art newborn baby unit, 3rd bed capacity, with CPAP that I believe is the newest technology, with babies, the youngest that was born 3 days ago by our inter-county MPDSR team, weighed 800 grams. This afternoon, I want to tell the world that I went there before I came here. The baby is alive, kicking under the qualified doctors at the Garissa Referral Hospital. For me, that is what devolution is all about. In the morning, we had the engagement on the youth, women, children, persons living with disability, older persons, and refugees, to see whether the budgeting that is done in this county, the development that is being conceived in this county, reflect the needs of the communities. And it was a testament that they understand their government holistically and they've received this service. As I conclude, I want to confirm to Kenyans that the gift that you gave to this country of devolution is working. And we want to demystify the myth that devolution has some challenges. We do not want to sit behind it. We have some challenges, but remember, devolution is only 14 years older. We have governments that have been established 63 years ago, and we still have challenges. The 15% revenue that is generated nationally is what goes to the county governments for purposes of development and recurrent expenditure. If we can attest to this, I tend to believe that there must be confidence that if more resources is availed to the county governments, then development would happen. Lastly, I want to confirm that devolution must be an agenda must be a national agenda. There is no growth, there is no progress without empowering the lowest units that are called developmental units that are devolved units. Empower the counties, development holistically will be realized in this country. Thank you very much, and I wish you the very best as we engage in this live session.
Many thanks. Let's give another round of applause, tafadhali. Ladies and gentlemen, we are due for our conversation, and if you're just joining us right now on NTV, we are in Garissa County for the Devolution Sensitization Week. Today, we will be speaking to a host of panelists who will be giving us context on the state of the healthcare in this county as a devolved service. And allow me to just give context, a little more context from a monetary point of view, because I'm a business journalist. CEO Mary Mwiti has spoken here, given very flowery details about how health is performing in Garissa County. And here are the numbers. Perhaps Governor will give more context towards it. The total budget, annual budget for this year 2026-2027 in Garissa County is about 9.89 billion Kenya shillings. Out of that, we've just heard this afternoon that 3.85 billion shillings has been allocated to healthcare. Perhaps you don't feel the effect of that. That is a little over a third of the budget. Please, Makofi, kwa Governor. And so, ladies and gentlemen, we just want to get a little more context on this, and that's why this panel will be here for you. This is not a lecture, it's a conversation we're inviting you to. So if you're watching from home, wherever it is you're watching from East Africa and around the world, we invite your questions. Please be part of the conversation. Na wananchi watukufu pia tunaomba muweze kujadiliana nasi. Si mtafanya namna hiyo? Allow me to invite our panel right now. And this panel will constitute 6 people, just like I have mentioned, 2 of whom are honorable governors. So, Your Excellency, Host Governor Nadhif Jama, please, most welcome. You could take the second seat, second left. Let's appreciate the Host Governor as he comes up. Up next will be Governor of Lamu, His Excellency Issa Timami. Mr. Host Governor, tafadhali, the second seat on the other side. Tafadhali. Yes, alafu Bwana Timami atachukua hiyo nyingine. Next up will be a representative of the youth, and this we will have Naste Farah. Naste, if you're here with us. There we go. Next up is Honorable Abdirahman Mohammed, who is the MCA of this area. Abdirahman, if you're here with us. Sorry? Please, karibu. Persons with disabilities will be represented by Hibo. If you're here with us, Hibo. And last but not least, the woman representative for Garissa. If you're here with us, Amina Siad, if you're here with us. As the woman representative comes, let me just appreciate in a special way my former lecturer, Professor Mutaha Kangu, who is here with us, who was one of the brains behind the Constitution. There he is. Hello, Professor. Good to see you, sir, from Moi University back in the day. Ladies and gentlemen, as I transition once again, I just want to invite you to the conversation. Let me occupy the seat. We need one more representation of a woman representative. All right, as we get directions, kindly protocol team, please take off the podium on stage. All right. Thank you so much, protocol team. Let me invite Sadia Abdullahi. Sadia Abdullahi. There you go. Let's appreciate her as she comes. One more time, MCA Duro, if you're here with us. There you go. He's already up on stage. Karibu sana. One last invitation, Mr. Nunde from the civil society, please make your way up on stage. Mr. Nunde from the civil society. There you go. There you go. Okay. Sawa, mpaka afike tafadhali. I love Garissa. Ken, good to see you, sir. All right. We have quite the panel here. Ladies, please forgive us, but at least there is representation one way or another. I expected this to be a full representation together with the women rep, so that would be 6-piece, as the name goes in the political scene. But once again, welcome. We are having this conversation live from Garissa. This is the Devolution Sensitization Week. I'm Brian Jojotino. I'll be steering this conversation. The theme today is devolution for healthcare, better or empowered communities. I have two governors on this panel, a youth representative, quite a representation right here. We just want to make an assessment of what it's been like seeing devolution work, especially for such a crucial, devolved function as health. Let me start with the host governor, who is next beside me. Sir, since 2013, when we saw devolution come into effect, up until today, there are people accessing services from Balabala, from Modogashe in your county here. What has changed since 2013 and today? What is the difference that an Ahmed from Modogashe, for example, is feeling today compared to back then in 2013?
Bismillah ar-Rahman ar-Rahim. Let me first of all say that I'm honored as the host governor to be hosting this very, very important discourse, conversation in my county, and appreciate the Council of Governors, the Secretariat, for getting the wisdom to do it here in Garissa. Now, without much ado, Brian, let me tell you that as an introduction to this discussion, if you want to see whether devolution works or is working or is not working, the key area or the key thematic function that you can look at before any other function is healthcare. Because if healthcare works, then devolution is working.
Correct.
And if healthcare doesn't work, then devolution basically is not working.
Yeah.
That's the reality. I can say without fear of contradiction, if you get right in healthcare, then you have gotten right in all the other functions devolved. And that's why, of course, we never claim perfection.
Correct.
But I can tell you that we have made some very good strides from what we inherited in 2013 as healthcare system. Yeah. And I can say in all the counties, but in my county, if you was to answer your question specifically on what does a person in Modogashe get or see differently. Modogashe, for instance, today, the people there comfortably enjoy uninterrupted supply of drugs, essential drugs, both pharma and non-pharma, all the way to them no longer requiring to come to Garissa, for instance, for a mother who needs a C-section.
Correct.
Because now we have theaters, well-equipped, well-manned, well-staffed, so that we are able to undertake very, very major surgeries in all our sub-county hospitals. That is something that was never there before. And in fact, we have made history, and it's only after devolution that we were able to see a C-section activities being undertaken, our surgeries being undertaken in our major or in our level 4 hospitals in the sub-counties.
I think that deserves an applause if you ask me. I genuinely, yeah.
So we could go on, but I will just give you an example. when we came on board, or devolution started rather, we only had in our major, in our referral hospital in Garissa, for instance, a level 5 hospital, and the name was PGH, Provincial General Hospital, which was basically, you could call the largest hospital in northern Kenya. And that hospital, which was supposed to have been the referral hospital for the entire region, because Garissa was the provincial headquarters, it only had 6 specialists. Today, we have Garissa Devolution. We're talking about 52, if not more, specialists in almost all the areas of specialization. That tells you a lot. Just one example. Mm-hmm. And therefore, we can comfortably say that devolution has indeed been a game changer. Thank you.
Great. We'll come back to the pain points later on. Allow me to invite Governor Timami on this one. Governor, we have transitioned from NHIF into SHA, or SHIF, as you'd call it. And so for a county like, say, Garissa, Lamu, and the larger northern region, knowing too well that these are counties that predominantly the economic activity there is livestock keeping and also ties closely to the pastoralist nature, what has the registration process and monitoring of incomes and access to health been like, especially with regard to now SHA being in place, because we have transitioned from NHIF and SSF? In essence, what I'm asking is the registration process and the follow-up mechanism to make sure that there's good uptake and these services, the health insurance services, SHA, nonetheless, is working for the people of the larger northern region.
Thank you very much. Good evening and assalamu alaikum. First, let me compliment my host governor.
Yes.
I visited his hospital, and if anybody has doubt that devolution is not working, he's welcome to come and see Garissa Hospital. Similarly, I could say the same about Lamu County. Our level 4 hospital is now one of a kind. So all over the counties, we see that health services have taken a leap for the better. Now, turning to SHA, initially, there were challenges. As any new system, when it starts, there are always challenges. However, we have put in place measures, and you know now there is technology, digitization, and I am proud to say that the uptake in our ASAL counties have been quite satisfactory. We have not been left behind. And I must at this point say that SHA is working. I just want to give you one example. In my health center at Kiunga, which is a border town near Somalia, they collected, or they were paid about 8 million shillings. And this was utilized to buy machines and also pay for staff, pay for utilities. And as we speak, because of this improvement, and we are already putting up a theater, a radiology unit, and we're refurbishing our wards, and we're converting it from a health center to a level 3 hospital. And this is all thanks to the payments that we receive under SHA. So those who doubt that SHA is not working, I think they need to rethink.
To check again. Lovely.
Yes.
Let me bring in Naste. And Naste, the reason why I'm bringing you on board is because we heard earlier on from the health director that there's been an elaborate system of community health workers and community health champions who are helping with tracing some of these pastoralists, who are helping with reaching out to communities who need these health services. Could you speak more towards that and how this has also impacted the young people of Garissa?
Distinguished guests, ladies and gentlemen, good evening. I'm truly honored to represent the young people in this panel. The Devolution Sensitization Week theme, Devolution for Better Health. By that, better health is not only about hospitals. It is about informing communities and so that the community should be more aware of what is good for the community. On your question, my brother, you asked me about how has, kindly come again?
The role of community health champions and community health workers and how this has impacted the young people of Garissa.
Yes, thank you. And Devolution is really working for the northern region, especially our county, Garissa. Previously, we had no community champions in the grassroots level. When Devolution came in 2013, we have seen hope because our mothers were dying at home because they had no champions to inform that we have a pregnant mother who could connect her to the hospitals. So since the Devolution has started, we have saved many lives, we as the youth of the northern region, connecting our mothers, our pregnant mothers, to the hospitals, so that to avoid them dying kwa nyumbani. So tumeona mwangaza kwa mara ya kwanza since 2013. Tumeona kwamba vijana wanaenda kila kijiji ya ku make sure that hakuna mama ambaye anakufia nyumbani kwa sababu ametoa damu nyingi. And I want to thank our governors, since the devolution, because wametusaidia sana to improve the facilities. Our hospital facilities has been improved immensely since devolution. So, and devolution is really working for us as northern region, and we, as the young people, have been really connecting our mothers to the hospitals. Thank you.
Kweli. MCA Duro, I'd love to indulge you on this next question. We have seen beautiful launches of facilities, lovely stocking of healthcare facilities and services. We went around a bit and saw a bit of that. What the Mwananchi cares for is that these services are active and they are consistently serving them, even after the cameras are off, after the launch. What is the plan around that from a governance point of view and from a resource allocation point of view? Because it's one thing to come and launch and do a beautiful launch, Gazeti, television, we will be there to support you. Lakini, what is the plan around keeping these facilities active and meeting the people's needs, even at 2 a.m. when there's an emergency?
There you go. Thank you, my brother. From that angle, being a member of county assembly and being a health committee member, I think after the launch, when the cameras are off, if I use a case study as my ward, Jarjara ward, where I came from, there is that health facility, absolutely. Then I can tell you, long before devolution, there was no structure in Jarjara ward for health facility. People used to travel all the way from Jarjara to Balambala, nearly 10 kilometers, to seek for medical attentions. After devolution, there was that time, I think the first governor was my current governor, Governor Nadif. In the year 2014, we constructed the first health facility in Jarjara ward with its what do they call the maternity wing and the outpatient side and everything. Yeah. From then to date, I can assure you devolution for health is working behind cameras, because to date the facility is improving. 5 years after 5 years from the birth of devolution to date, I can vividly say that devolution is for health is working way behind cameras. After the launch, after everything, I can tell you it's working. And to attest that, as a health committee member, we passed at the assembly because we help to pass the laws. We passed the FIF bill, the Facility Improvement Fund bill, that really helps the facilities to have access to quick funds, so that they can take care of themselves long before even the government chips in. There is that serious accountability, because FIF bill that contains hospitals will be having, despite them having access to the money, also there is that accountability that it is all the time there. Well. So I can attest to that devolution for health is working way behind cameras.
Okay.
Yeah.
Lovely. Hibo, let me bring you in on this one. Kwa sasa, you represent a very sensitive part of the community, which is the PWDs. Sorry? Oh, kunradhi. Hibo, ningependa nikuulize swali hili. Unawakilisha kikundi maalum ya watu ambao wanaishi na ulemavu. Ni sekta ipi ambayo unaona kwa sasa bado ingetiliwa mkazo kidogo, ama ingepatiwa attention kidogo, ingeimprove hiyo situation ya uwajibikaji ama utendakazi kwa watu ambao wana ulemavu katika Garissa County?
Asante sana kunikaribisha. Tunahitaji health, mambo na health ndo tuko wiki kidogo, because sisi tuko na watoto wa ulemavu, wale wako na autism na physical disability. Wale wako na physical disability at least wanajikakamua, wanaweza kutembea, lakini wale wako na autism wanafaa kwenda hospitali kila siku kufanyiwa physiotherapy. Sasa hiyo physiotherapy naye mzazi hawezi beba huku kupeleka huku, kubeba, yani kama mtu anaishi kama Bulaiftin, kutoka Bulaiftin to General Hospital it is far place to huyo mzazi hawezi beba mtoto na mgongo, anaweza kuwa hana fare ya kwenda paka huko. Hiyo tu ndio inatusumbua, lakini hivi vingine tuko sawa hapo.
Very nice. Na uzuri ni kwamba unaongea na gavana yupo hapa, kwa hivyo he's taken note of it.
Yeah, na pia tuko na ile registration ya disability ya card, NCPD card. Hiyo tukienda kwa hospitali, kuna wengine wanahitajika, yani kuna wengine hiyo wanahitajika, hiyo karatasi ni kama ID, hiyo certificate ni kama ID. Na wengine hawana pesa, wakienda huko wanasema wanalipishwa 500 fees, maintenance fees ya hiyo card ya disability. Hiyo pia tunataka tuangaliwe na tusaidiwe hapo.
Great. Perhaps Governor Timami, you will speak to that, and I'm seeing Governor Nadif also nodding. You'll speak to that and how we can digitize some of those health records, kwa sababu wangapi hapa waliwahi tumia ile yellow card, ile ya clinic, the yellow card ya clinic. Can you trace it today? Ken Odede, can you trace yours? Is it there? So now we need to think about digitizing that. I think Governor Timami perhaps will speak to it later on. Let me bring in Sadia as we go towards the end of the first round of questions. Sadia, we have seen massive improvement in maternal health care. Where do you think we are still lagging behind, and what can we do to fix those gaps?
Thank you very much for welcoming me. And my position is economic empowerment of girl child, women, and youth.
Correct.
I do economic empowerment of girl child. Yeah, I do economic empowerment of girl child, women, and youth. I am a director in a certain organization. My career is economic empowerment of girl child and women in livelihood department.
Correct.
In livelihood, in my organization, I have 5 sections. I do livestock product processing, all kind of fruits, whether it is a mixed fruit, whether it's a single fruit. I do product processing, product pasteurizing, packaging up to the cave level of any kind of fruits. And also in livestock, I do meat and milk processing. I am food science technician from JKUAT. I am manufacturer. I am the soil asset of Garissa. I was born in Garissa in early 70s. I landed here, I worked here, and I went to abroad. I get the skill and came back to my country in order to upgrade my real motherland here in Garissa. To upgrade in my motherland, help youth, women, and girl child through skills. I also do product processing in textile. I do tie and dye, batik, screen printing, carpet makings, and other product. And I am a technical teacher. I
Great.
have taught 15 years
Great.
in KITT, Kenya Technical Training Institute.
Great.
Now I have retired. When I have retired, I have formed my own organization. I have seen a wild skills. In textile, I have learned the 5 principal classes of textile: gold, mineral, fiber, acrylic, cotton, and silk.
Lovely, Sadia. Lovely.
I'll continue still. I have
Lovely.
not covered my skills.
Now, the question. Can we talk about the question about maternal health care? That one, please.
That's not my career. My career is a technical and hand skill. And that is what I know.
Okay.
I am an entrepreneur. I am a manufacturer. I have 2 factories in Nairobi.
Okay.
And I have here a center which is accredited in NITA. And actually, the five classes I have not completed: textile, livestock, and farm product processing.
Okay.
And also I have added this year in social emotion skill.
Lovely.
So, as I am here, I want to tell all the leaders, the members of the community, youth, women, and girl child, that I am a manufacturer. I process a product in 5 sectors with shelf life of 18 months to 2 years.
Lovely. Lovely.
Yeah. And I want to become the first woman who is doing product processing here in Garissa, so that our counties, youth and women, learn about hand skills. So
Great.
let them.
Thank you.
Let me tell them that I want them to inherit my skill.
Thank you.
I want to tell
Let's
our
get back
governor.
to. We'll come back to you. Let me talk to Khalif, because we are live on TV and we need to move. Khalif, let's handle perhaps the most important bit of healthcare, the human resource. With this equipment that governor is launching, with the advancements, we've spoken about community health champions and community health workers. What's the strategy about retaining these important specialists who are handling special cases in the county and handling these very sensitive cases once again? What's the strategy around making sure that they're properly remunerated, they're empowered in research, and also this is done in a sustainable way?
Thank you very much. Can I use a bit of Kiswahili and tell you?
It's allowed.
Chama chajiuza. You see, putting it differently, the taste of pudding is in the eating.
Correct.
You see, the national government is already taking our referral hospital.
Okay, bring your microphone close. Yeah.
Actually, our hospital is being taken over and being pushed to level 6. So what else do you want me to tell you? Because if you're going to serve Wajir, Mandera, and this is going to the Kenyatta National Hospital, are you asking me how well they're doing or how they will be able to retain? How did they go up to that level? We have a very tough, Mahad, can you stand up for a minute? Mahad, the CEO, but then the buck stops with the governor. Having put everything in place. So thank you, Mahad, sit down. So there has been a lot of improvement only in a short period of 3 years. But let me come back to my organization as a civil society organization and tell you what we do. It's our job. We keep breathing on the neck of the MCS and these other people to make sure that the county integrated development plan is taken to the villages. People decide what they want, what is going to be in the budget, how do they want to do it. The other day, we actually sat with my governor here, and he's actually a very respectful, with his county secretary here. We sat down and they had to appoint the Public Finance Management, under the Public Finance Management Act. We had this finance committee, an equal number from the public are supposed, that is one section 37 of, it's called CBEF, County Budget and Economic Forum, an equal number. When the ministers are 11 here, they sit here, we also have the same people. I don't want to go out of the topic of health. I'm telling you, health speaks for itself, and this is why we are all here. It has improved and it has gone to that level. So there is no need repeating because already the test of pudding is in the eating. And you're a witness tonight. Please, Karibu.
Lovely. Governor, you have one question. Let me first indulge Governor Nadif on this one before we open it up to the public. And I'm going to ask the MC to help me pass the microphone around so we can have comments, questions from Wananchi directed to specific panelists. Governor, you've heard the sentiments of your fellow panelists who constitute your constituency, the Garissa County. You've heard about the PWDs and their needs, but before we handle that, what keeps you up at night? What is this one thing you haven't achieved in the health sector in the county that you are determined to leave a legacy in for the people of Garissa?
What is the one thing that currently is keeping me awake? I think I would say it is the mother and child hospital that I'm constructing, which is about 70% complete now. And I wish it can be, concluded tomorrow, the construction.
As soon as tomorrow.
Because it is one of the most important, should I say, investments or legacy activities that I want to leave behind, hopefully within my term.
Yeah.
Because, as you know, we have had our programs as a region in terms of our mortality rates. And therefore, when I came back to office in 2022, that was among the first projects I had initiated to create one of the biggest facilities in the country, a 430-bed facility, so that it can serve the entire region in matters of mother-child mortality rates, so that we can work on that one seriously as a region, with this facility being the anchor of that whole issue. So really, if I was to worry about one thing, it's, of course, there are many other smaller issues that we keep perfecting on a daily basis.
Yeah.
As I said initially, there's no perfection that we can achieve as human beings, but this one here is one issue, because I believe once completed, this facility will serve this region in a very, very, very big way, so that we reduce our mortality rates, which of course actually is already coming down drastically in our region as a whole.
Great.
That includes both Wajir also and Mandera.
Yeah.
And also the other counties. So for me, that is one major issue.
Yeah.
But on the positive side, as you were told, even by our civil society chairman, chairperson, the whole issue of us now looking forward to the upgrade of this facility, our level 5 hospital, is because of what we have achieved so far. If indeed we did not achieve the levels of, should I say, great strides, then even, the national government will not have realized or come to us for that. So now we are talking about upgrading the hospital so that we can see more and more positive results for our people.
Lovely. Governor Timami, 1 minute so you can respond.
Sorry. About the disability. In my county, we have waived fees for disability cards. Processing and physiotherapy for all under 15, it's done free.
Wow.
And we have also set up 4 centers where we undertake this free of charge for all those with disability.
Lovely. Makofi kwa panelists, jamani. In case you're joining us right now, we are coming to you live from Garissa. This is the Devolution Sensitization Week, and the theme of the conversation today is Devolution for Healthcare, Empowered Communities. Garissa is emerging as a benchmark county in terms of healthcare and the services right here. We've witnessed for ourselves, and that's why we're coming to you live from NTV here in Garissa. Allow me now to give and to open the floor to the public. Questions, comments, answers. I love the energy in the ground right now. The lady at, yes, please just stand. Just stand. Yes, yes, yes. The lady with the lanyard, yes. Please introduce yourself and ask your question channel your question to one panelist so we manage time.
All right, thank you so much. This is an amazing panel that I've seen here. I want to thank the Excellencies for setting up this Devolution Sensitization Week. Your Excellency, a healthy county is a wealthy county. And a wealthy county starts with empowered women and youth who can earn, feed their families, and afford health care. I want to talk about, it's a good job that you're doing with the Garissa Hospital, but also, as I mentioned, I work for an organization known as Hashash, and I'm glad to see our director is here on the panel.
Great.
And it's been building a foundation for the 27 years. My question is, what is the county's vision for ensuring that economic empowerment and health go hand in hand? Because when women earn, children they eat, and they can go to hospital, and youths have jobs. So we'd like to answer that question, and thank you so much. We'd love to partner with Garissa County.
Lovely. Diversification of economic benefits. Let me have Osido. Osido is in the crowd here. And then we'll come to the gentleman on the front. Please, panelists, take note of the questions, and then we'll respond at a go as we continue our live broadcast. Osido?
Yeah, thank you so much, Brian. Locally, we call you Brio. And I'm just wondering, I have a question for the two governors, particularly around a very fundamental facility, which is called the FIF, Facility Improvement Fund.
Yeah.
And Brian, you began this very exciting conversation by giving us statistics.
Correct.
And they say numbers don't lie.
Correct.
Now at County Governance Watch, we try to crunch what the counties are doing, particularly insofar as on-source revenue is concerned. And you issued the budget of Garissa County, but if you look at the on-source revenue of Garissa,
yes,
we note that for the financial year 2024-2025, Garissa collected more than about 470 million.
Correct.
And 80% of this came from the facilities. The facilities as a source of, revenue.
Yeah.
And of course, we need to appreciate the governor for that, because that is really something that is profound.
Exactly.
Not most counties are doing that.
Yeah.
Yesterday, the CS for Health was here. And he, of course, shared a number of things that they are doing together with county governments. But from where we look at accountability, and especially when you look at devolution of functions, we still have this very clear conviction that there is a lot of money that the national government is still holding that need to be sent to county government. But listening to the CS yesterday, I got a little bit disturbed because governors are seemingly comfortable with the kind of partnership that is going on, particularly on devolved functions. Why is it so difficult, to send as much resources so that county governments do not have to struggle with their own source revenue streams to be able to support the good work that county governments are doing. And I'm asking the two excellency governors to basically just share their experiences, because failure to ensure that this happens, I think that we are going to be expecting so much as a citizens from our governors and our county governments, whereas there is still a lot of resources, especially the financial resource that needs to come from the national government to county governments. And thank you for the opportunity.
Please, I'd like you to inform the House, and this is why we really wanted the Senator to be here, because that is the role of the Senator constitutionally. Yeah. The previous financial year, we saw 6% of the national government budget being channeled towards healthcare. What is the percentage this financial year?
Of course,
has it increased?
Of course, well, it has increased, particularly given the kind of the equitable share. Remember that has also gone up by about 15-20 billion shillings, exactly, and we are hoping that a bigger chunk of that will go to critical sectors like health. So I would say that yes, it has increased, but not as much as what we'd expect if that particular function is devolved to counties. But of course, the governors and the CEO of the Council of Governors, they know much more better than from where I am sitting and watching. Yeah.
Lovely. Can we take 2 more questions and then we allow the panelists to respond to the first round of questions? Just speak. There's a gentleman here, there's another gentleman there. Ladies, we'd also love to hear from you more. And if you're watching from home, we'd also love to get your questions at Brian George KE on Twitter, at NTV Kenya. Please.
Thank you very much for this great opportunity. Hamza Abdimar is my name. I have 3 brief questions directed to the Governor of Garissa County. Bona Governor, I have seen the county government has been talking about several projects, including the health, which has been the topic of discussion. I personally today I did a tour in the several departments of Garissa County. Personally, I made a tour to the Department of Education, and I discovered that we have the county government since the inception of devolution has constructed 334 ECD centers, 217 being public and the rest are private. And actually, this is a great transformation. But when you look at the website of Garissa County, this is not actually reflected, because I was having one-on-one conversation with the director of ECD.
Yeah.
So what recommendations that I want to give to you, Bona Governor, is that the county government might be working, but sometimes these projects, for purpose of accountability, they should be posted in the website. My second question.
Okay. Hoja nzito sana.
Bona Governor, I believe the national government today has introduced what we call the Nyota Fund. This is a project from the national government to support the young people in entrepreneurship. Governor, I am fully aware the year 2024, you launched 34 million for the revolving fund. Then afterwards, the financial year 2025, that money was not well captured in the financial year. Do you mean that your county government does not support young entrepreneurs, or you felt that revolving fund was not important? Bona Governor, I want actually to also ask you, why is it that the revolving fund that you gave that 8 million, we've not seen the beneficiaries from each and every ward? Because you are supposed to have the report so that we see the implementation status, how the revolving fund was effective. Bona Governor, the third question I want to ask you is that this is a national event. I believe I was actually following up the conversation towards the media and everything. I saw the planning committee of this devolution week. In the conversation, I was actually seeing the pictures in the Facebook. I saw each and every stakeholder was involved. I never saw any young person in the planning committee of the devolution sensitization week. Young people are involved at the implementation stage. I believe, yes, we have a young person representing us in the panel discussion, but he is involved at the implementation stage. Was he involved from day one? Were other youth groups involved? Because Garissa County has several youth groups. And this actually brings to me the next question. The county government of Garissa has launched what we call the County Youth Council, but not implemented. Why, Bona Governor?
All right.
Because I believe if today if at all we could be having a structured county youth council, from the ward representation to the constituency level and even to the county level, the county government could be having a structured youth group so the county government can engage us. The last question as I conclude. The last question.
You've asked for. Asked for. To be fair to others, please allow me to introduce another person.
Thank you very much.
Pass the microphone. Keep it very brief so that they can have the first round of questions of response, and then we continue. Yes, please.
Thank you.
Keep it very brief.
Okay, I'll be brief. My name is Abakar Isaac. I just wanted to comment about our moderator. He said that the Garissa County government generated a lot of funds from hospitals. But as a champion, budget champion, and trained by budget facilitators, I can tell you, if you see a county government that only depends on health to generate own source revenue, that's a dead county. The second thing that really worried me was Garissa County was generating its source revenue from this hospital. But if you look at that data, Modogashe Hospital is generating 98% of the own source revenue. And when you check at level 5 hospital, ambaye ni kubwa sana, is generating less amount. So I'm worried what's happening.
The disparity.
Right.
All right. Allow me to say that we are closing the live broadcast. You have been watching the Devolution Sensitization Week. We have been coming to you live from Garissa. We have the panel here with two governors, that is the host governor, Nadif Jama, and the governor of Lamu, Issa Timami. We have a representation from the young people who have been here on this panel with us for the last 1 hour or so. We just want to wrap up the live conversation. We are continuing digitally, but this conversation, of course, is continuing. We want to hand you over back to normal programming. My name is Brian Jojotieno. Thank you so much for staying with us. Please, could we appreciate our panelists and the live audience that's been here as we end the live broadcast on the Legacy Media. But we continue digitally, and the session is still on ground here. Asante sana.